I'm here today for my knee surgery. I'm having arthroscopic surgery by wonderful Dr. Millstein. Found him on the internet after I fell over a cement barrier at the house. My pre-op was just great, and I'm looking forward to this surgery.
So she's a very active lady. She came to see me because of a meniscus tear that was diagnosed from another physician. She's had pain for a couple of weeks and has been unable to move her knee.
I'm not nervous at all. My level of threshold of pain right now is like a 2. I got really lucky. It's just I have a tear and they're going to fix that up for me.
And she can walk with pain, but she's unable to play sports.
Can't wait to get done.
In this case, the meniscus is not only torn, but a large piece of the meniscus has flipped out of place. So while it's not an emergency, we treat this more urgently. And so instead of going back home to the desert, she elected to have surgery here today. So the surgery involves an arthroscopic surgery. That involves putting a camera inside the knee. So this surgery will be removal of the part of the meniscus that's torn, leaving the rest of the meniscus intact. It should take about an hour. She'll go home an hour later. She should be up and walking tomorrow with very little pain, off of crutches the next day, and back to normal activities in the next month or 2. So for this surgery, the patient's asleep with sedation, but breathing on her own and typically not intubated with a tube down her throat. But that allows the surgery to go well without her moving or being aware of what's going on. And then we also inject local anesthetic into the knee. The sheath allows us to put the camera into the joint. Now we're going to look in the medial aspect of the inner side of the knee. And again, here's a thigh bone, here's a shin bone, but you see this piece that shouldn't be here. And that's the meniscus that's flipped out of place and acting like literally like a doorstop. It's impinging. As we try to straighten the knee, you can see how it literally gets in the way and moves, and it's stuck in there. So that's not good. Here's it's called a basket or a punch or a biter. It looks like it bites. We just start cutting. This has teeth and it rotates and sucks in, so it only theoretically cuts out bad tissue. A large portion of the meniscus has been removed. We can see whatever's left is stable and not moving around. Pull on it, doesn't go anywhere. This surgery involved removing the torn piece of meniscus and leaving the remainder of the meniscus alone. I expect that she'll have an uneventful recovery. She'll be on crutches for a day or 2. Start walking tomorrow, possibly do some physical therapy in a week if she'd like, or else she can start to exercise on her own. And I generally expect people to be at about 70 to 80% of their full activities at 1 month and 85 to 95% of their activities at 2 months.
It's 9 days since my surgery. I have not had any pain, and I'm doing really well. I was walking around about 4 days afterwards, and I've been icing, but no problem at all. And I just got cleared to start my physical therapy. I can do it at home, and I'm just thrilled with the results. I'm looking forward to getting back and playing golf and doing my long walks. I'm very active, and it was killing me to be down for a few weeks, but I'm up and at 'em. The staff has been incredible, very, very helpful, and I'm going to come back here probably for my shoulder in October. Thank you again, Dr. Millstein.